Welcome back, viewers at home. You're still tuned in right here on INX Prime Channel 345. Joining me this evening is Mawethu Bell, who is a social worker with the CHOC Childhood Cancer Foundation South Africa. Now, since its inception in 1979, CHOC has grown into the leading foundation in the country, providing comprehensive support to children and teenagers with cancer. Today, Mawethu will share with us the work CHOC does and the challenges faced by the families they support and the profound impact of their services. Mawethu, good evening and welcome to INX Prime.
Good evening and thank you.
Can you tell us a bit about yourself? Who is Mawethu and exactly what inspired your involvement with CHOC?
Okay, Mawethu, I'm from Port Elizabeth. I was born and raised there. I studied in PE, and what inspired me to do my work with CHOC, I think it was in my last year at university. I wanted to do my practical experience, and I wanted to go into a psychiatric ward. However, CHOC was available, and yeah, I've enjoyed my stay with CHOC ever since. I haven't looked back.
Now, just giving us insight on, because you know, when we think of social worker, we know that it's someone who helps us deal with certain socio-economic or other social issues within communities. But what would you say are some of your roles and responsibilities at CHOC?
Yeah, when it comes to the pediatric oncology, it is quite different than what you have studied at school or what you know of social work. We do a lot of counseling and we do a lot of education. And when it comes to education, you're educating the patient and the families about the diagnosis, because you have to bear in mind most of the patients diagnosed with cancer, they come from the black communities whereby cancer is still a taboo, it's still a white man disease. So you need to do a lot of education and to support them during the entire process. So that's what we do mostly.
Now, seeing that earlier on, I did mention that as CHOC, you assist families, in terms of, supporting them. And I would like you to just highlight to us, what does that support look like for those families from the time the person receives the diagnosis to them now getting treatment?
I think the first support we provide is the emotional support, because often families, they always feel like they are alone in the journey. So we have to walk the journey with them to show that they are not alone, and to give them more hope while they are in this journey, and to ensure that, yeah, they know, like, most importantly is education as well, because education plays a huge role in the work that we do. So we're always educating them, and we always advocate for them as well, because most families, they come from poor backgrounds and they are not assertive enough to ask questions. Like, the doctor will be breaking the news to them about the child's diagnosis, and they are shy to ask questions. So we become their voices in the entire process. So that's what we do, and some of the services we provide to ensure that the child doesn't default from the treatment. We make sure that they have like a transport to come to the hospital, because they need to be at the hospital quite often, and it's a lot of money. Some of the families, you will find that they are unemployed, there is no money, so they need that support to ensure that there is food, because the child now has treatment and they need to eat. So the food that they eat, we need to ensure that it is healthy food, the food that is going, like, is not against their treatment. So yeah, those are the kind of services we provide to them, and we ensure that they have toiletries as well, because that is another issue. Some of them, they struggle with toiletries, so we ensure that they have those basic services. And some of them, they come from very far away. So we, like, for instance, where I work at Charlotte Maxeke, there is a CHOC house in Saxonwold, which is like 5 minutes away from the hospital. So they are able to sleep there, and that is a home away from home. And most of them, they find it homely and they enjoy it. So they've got toys, like, they stay there for free, they eat there for free, they get transported to and from the hospital for free. So those are the kind of services we ensure that each patient and family gets access to.
Now, when we're talking about the conversation around cancer, it's very heavy and quite sensitive. And as you mentioned, especially in the black community, it's such a taboo. And I think walking this journey, your emotional well-being needs to be intact as well as supported. I want to know from you, what would you say are some of the common challenges when it comes to the emotion side of things? And how exactly do you guys go about assisting them? As you mentioned earlier on, you guys prioritize the emotional well-being of the patient.
Yeah, I think one of the main thing families face, they always think that their child is dying.
Yeah.
So it's always about death. So there's so much anxiety, there's so much fear, there's so much doubt if the treatment is going to work. But if you continue to be with them, like, I think consistency is more important in the families. That's what they need. And if they see that you are consistent in what you are saying to them and what you are providing to them, then they learn to trust you and they learn to believe that they are not alone. They see other kids in the journey as well. Like, I was speaking to a new parent today, and she was telling me that her teen, because it's newly diagnosed, I think about a week ago, thought she was alone. But until she came to our hospital, and then she realized that she's not alone in the journey. There are more other kids who are going alone. And yeah, life continues. Life continues.
Now, the amazing work done by CHOC, I believe there's another program, and I just want you to just give us more insight on it and just tell us the impacts it has on the newly diagnosed families, which is the Parent Supporting Parent Program.
Yeah, unfortunately, I don't have it in my hospital, but I do know what the mothers do amongst themselves. So what happens is that in our wards, the parents stay with the children.
Yeah.
So when they arrive in the ward, they have their own WhatsApp groups. They talk amongst each other. Like the mother that I was talking to you about earlier, she was telling me that one of the mothers told her that she doesn't have any family in South Africa. She's from Zimbabwe. She doesn't have anyone supporting her. She's on her own, so she doesn't have visitors. So this mother learned to be grateful that she has support, even though it seems to be hard, but her life is not totally in shambles. Yeah.
Now, I believe earlier on you also mentioned the idea of providing transportation to, some of the families, or should I say the patients involved, or who actually are coming for the treatment. Can you give us more insight on that? Because I believe everything that you guys are doing is free.
Yes. So we ensure that because we don't want them to default on treatment, so we ensure that they come for their dates, whenever they're scheduled to come. So we provide transport money to the families. So it's either the child is coming with the mom or whoever is taking care of them. We provide for both of them the transport, and we also link them as well with other organizations that can assist them as well financially, because we do not want them to rely on CHOC only. So that is one of the most important things, to refer to organizations. Like we have other organizations like Cupcakes or SASA, so they get more support.
Yeah. So this is like a teamwork where if CHOC is not able, they have individuals who they can lean on in creating a very support-based system that works better for the patient and the parent. Now, coming to my other question, how does then CHOC go about creating this awareness outside of, having that direct link where the parent is bringing in the child? Is there a form of, certain activities that you guys do just to spread information and awareness on the work that you're doing and just on breaking the stigma around cancer?
Yeah, there is a team dedicated to that. So they do awareness campaigns at schools, they do awareness campaigns in the clinics, they train the teachers at schools, and they also provide trainings in the local clinics or in the villages, because these kids come from those communities, and if they cannot see, like they are not aware of the signs, then it means that the child will be diagnosed later and the prognosis will be poor. So hence CHOC always ensure that they create awareness in the schools, in the clinics. So that's how they go about doing it.
Mawethu, another thing I want to understand is, in what ways does CHOC go about advocating for children with cancer and life-threatening blood diseases?
I think one of the biggest areas CHOC advocates for children with cancer is ensuring that the child is involved. For instance, when we break the news to the mother, we always emphasize to them that the child needs to know that this is what is happening to them, and this is the treatment that they are going to get, and this is what is awaiting for them. So most of the time, especially in our black communities, again, parents do not want their children to know because they always feel like the child is going to give up. But we always encourage them that in order for this journey to be successful, we all need to work together. So we advocate for the children to be involved in the journey, not to be isolated because they are the ones going through it. They need to be part of the entire journey.
And you'll be surprised how resilient children are.
Yes.
And, you know, they have that courage. It's just you out of emotions that you actually assume that they're not. Now, Mawethu, seeing and hearing on the different work that you are doing with CHOC, I have to say it's a lot. It's commendable. But I think this question now is directed to you as to how do you still stay motivated to continue doing the work that you do? And most importantly, how do you ensure that, you know what, your cup is also filled?
As you mentioned earlier, that children, they are resilient. And I mean, there is a saying that once you work with a child who's fighting cancer, they will change your life forever. So I think that is what has kept me at CHOC all these years, is the resilience of the children. You'll see a child a day before looking as if they are dying, but the next day they are out there playing. So they fight and they give you the courage to keep on going with life. So, and yeah, that's how it is. And I mean, like, I also try to keep the cup full by ensuring that I do get proper supervisions from my superiors. So that is more important, because I feel like when the child has relapsed, when the child is dying, it hurts me as well. So I need to have someone to talk with. So I have that, fortunately, and my manager is from CHOC. Yeah.
Now, one last question to close it off. What's the one thing that you hold dear to you and you live by and you always remember, and it keeps you grateful that you saw from interacting with the children?
Yeah, I think it's the fighting spirit. It is the fighting spirit. Yeah.
Mawethu, thank you so much for coming in and, you know, sharing the work that you do and seeing and just letting us in terms of what CHOC does, what you do, and how as a collective we literally can be that support system that can assist the children to see the best and be the best that they can be. And thank you so much for joining us.
Thanks a lot for having me.
Viewers at home, that was Mawethu Bell sharing in his role as the social worker at CHOC and the beautiful work that he does interacting with the parents, with the children, just seeing them through a very heavy and quite challenging journey. But that's where we're closing it for now. Let's head over to an ad break. See you when we come back.